Hey guys, what up? Real quick before I get into today's video, Jamie Lynn here, baby Chase. We are talking about hand, foot, and mouth disease, and I wanted to let you know that we are currently on day 4 of this really nasty viral infection, and we are kicking its butt. I mean, we're still having some issues with, I don't know what that was about, Chase. We're still having some issues, with some of the sores, but we have already got through the worst of it. So I definitely want you to stay tuned to this video because I give you all of my tips and tricks. I recorded it yesterday, but I also wanted to mention, I hadn't mentioned, but we're drinking a lot of juice and I've been having a lot of coconut water. And I do mention that hydration is definitely the key to kicking this thing's butt. And the juices that I have, it's not like apple juice, like store-bought apple juice. I'm actually making my own juices. I juice here at home and Chase drinks some of those too. So that really helped us get it out of our system faster. I wanted to just kind of fill you in on that before we got really into the video. And then just one final thing. Again, this is Jamie Lynn and baby Chase, and often we're accompanied by a sweet little baby Kalina, who is 7 weeks old. Please, I would just be so grateful if you guys subscribed to my channel and liked this video. It helps me out so much. I hope that you guys are able to overcome this nasty virus as quickly as possible. But if you're into mom things and mom life and watching little Chase and Kalina grow up and seeing our daily struggles and fun times that we have, I would love it if you subscribe to my channel. It would mean so much to us. Thank you all so much and have fun. Enjoy the video. Gonna say hi, Chase? Come sit with mommy. Say hi, everyone. Welcome to another video. Hi, everyone. Jamie Lynn here. This is baby Chase. Say hi, baby Chase. Say mwah. Bah. This is baby Chase, and this is baby Kalina. And today we are going to be talking about why we are so miserable right now, and that is because we as in Chase and myself, have both contracted hand, foot, and mouth disease, and it's absolutely miserable. So stay tuned if you want to hear about this and find some ways to get relief, because we are keeping on top of it and we want to help you do the same. So stay tuned. All right, everyone. Today we are talking about hand, foot, and mouth disease. Before I begin, I want to let you know that I am not a medical professional. That this knowledge is knowledge that I have obtained myself from places like the internet. And also because Chase and I, and Kalina in fact too, all went to the emergency room yesterday and we got a medical diagnosis from a real doctor, and she also gave us advice, so I am passing this along to you. Hand, foot, and mouth disease is not in fact a disease, it is actually a viral infection, and despite how miserable it is actually considered to be quite moderate and not too terrible. It's not gonna hurt you, it's not gonna kill you. Okay, it does hurt, I lied about that. It is gonna hurt you a little bit. But I wanna talk to you guys today because obviously we have a few concerns, such as trying to ensure that Kalina does not contract this terrible virus. It is not easy to keep contained because this virus is highly contagious. So I'm going to go over with all of you guys things that we are doing to get relief, and then ways that we are trying to prevent Kalina from getting it. So let's get right to it. Like I said yesterday, Chase and I went to the emergency room and we got a medical diagnosis from a doctor. We did suspect that we had hand, foot, and mouth. Chase is covered in bumps, literally head to toe. It actually began around his diaper and leg region and then worked its way up his body, which is not exactly typical. Blisters forming on his hands were one of the last places. I did not realize at first, but he does have it quite bad in his mouth, and at the same time he is cracking molars at the same time. Chase is only 15 months old, so this is very agonizing for him. Those blisters become very painful when they break. Hand, foot, and mouth disease is likely to stay for around 1 to 2 weeks. They say typical time is about 10 days. So if you have this, it's going to be time to get cooped up and stay cozy at home for as long as you possibly can, because like I said, it's very contagious and you don't want to spread this to other children or members of your family or members of your community. Some ways that we've been finding relief, because like I said, Chase was in agony. We actually had an entire night where he was unable to sleep. So unfortunately, this virus tends to make children extremely restless and unable to sleep very good. So I'm going to prescribe to you, and you're going to have to follow up and make sure it's okay with your doctor. But I'm going to let you know exactly what we are doing with Chase to get him relief. And today is day 3 of our infection, and it almost looks like it's peaked for both of us and that it's kind of as bad as it's gonna get. I have new bumps today, but Chase doesn't seem to have a lot of new bumps today. So I'm hoping that he is kind of on the upside of this, and I'm gonna let you know how we are doing that. So the number one most important thing is to stay hydrated. Because of the sores in your mouth and throat, it makes it painful to swallow, it makes it painful to chew. So staying hydrated is very difficult. What we are doing with Chase to ensure that he stays hydrated is we have him on a prescribed regimen of ibuprofen and baby Tylenol. We are alternating those every 3 hours. That is what his doctor recommended based off of his medical history and his current height and weight. We are giving him his age appropriate dose every 3 hours, alternating those 2 medicines. And it has definitely helped us so much. It helps ease the pain because these blisters are very painful, and Chase is able to eat and drink. We're giving him mostly water and occasionally some juice, but for the most part, he still really enjoys that toddler transitions formula, so he's been having that as well. Next thing that I want to talk to you about is his restlessness. He's not sleeping very good at all because of the itching and the pain caused by these bumps. So we actually have him on baby melatonin. Now, I will suggest to you, like I said, first of all, ask your doctor if this is okay. We did get a CVS brand melatonin, and I did not like it compared to Zarbee's. We very much prefer Zarbee's baby melatonin, and I'm going to link everything in the description so that you guys can get relief. So the first thing that we're going to talk about is the baby ibuprofen, baby Tylenol, and baby melatonin by Zarbee's. I like those. I will link all of those in the description below just so you can familiarize yourself with their names. That helps your baby to sleep because, like I said, he or she is going to be extremely restless, and they sometimes don't sleep for more than like 10 to 20 minutes, and it's absolutely agonizing when they wake up screaming. The next thing that I'm doing is I'm regularly giving Chase baths with bath salts. My favorite is Dr. Teal's. It's a pink Himalayan sea salt with like bergamot in it. That's my absolute favorite. Again, I will link that in the description so you can check it out and see if that's something that you want. That's my favorite one. I actually didn't have that, so I used a generic brand, something that my mom had picked up somewhere. It's not as good, but it still gets the job done, so at least that helped a little bit. The next thing that we are doing to ease a lot of this pain is I've been putting a lot of eczema lotion on some of the bumps because they moisturize the bumps, as well as some of those eczema lotions have a little bit of an anti-itch. Our favorite is either by Aveeno or Honest. Those are my 2 favorites. This can work on you as an adult as well. But with the bath and the bath salts, that really goes a long way to ease the pain of your baby. Babies will definitely like popsicles or drinking juice, like I said, just to deal with the sores in their mouths. But for the most part, I think that we are seeing a lot of really good healing because both Chase and myself are actually plant-based eaters. That means that most of what we eat comes from plants. So Chase has been consuming a lot of blueberries, which blueberries are really soft to chew. They don't scratch or irritate your gums or tongue when you have the sores in your mouth. And they're also full of water. They're full of water and little juices from the blueberries, so you get a little bit of hydration out of them as well. But eating plant-based and drinking a lot of fluids is probably one of the biggest things that we're doing to overcome a lot of this pain and agony and get through this virus as quickly as possible. Now, things that I'm doing to prevent Kalina from getting it. Kalina was 7 weeks old yesterday. She's very young. So we really don't want a 7-week-old baby to get this. The number one preventative way is obviously washing your hands. This virus is spread almost the same exact way as a common cold, through coughing, through touch, through saliva, through infected feces or urine. Just every way you would probably get germs from a cold, you will also get germs from this as well. So it's very important that you're washing your hands and trying to cover your mouth when coughing, and then disinfecting infected surfaces like door handles, shopping carts, anything like that. The other number one way, especially for a baby of Kalina's age, to prevent her from getting this virus is actually exclusive breastfeeding, which fortunately Kalina is exclusively breastfed, so we at least have that going for us. Hey guys, what up? Real quick before I get into today's video, Jamie Lynn here, baby Chase. We are talking about hand, foot, and mouth disease, and I wanted to let you know that we are currently on day 4 of this really nasty viral infection, and we are kicking its butt. I mean, we're still having some issues with, I don't know what that was about, Chase. We're still having some issues, with some of the sores, but we have already got through the worst of it. So I definitely want you to stay tuned to this video because I give you all of my tips and tricks. I recorded it yesterday, but I also wanted to mention, I hadn't mentioned, but we're drinking a lot of juice, and I've been having a lot of coconut water, and I do mention that hydration is definitely the key to kicking this thing's butt. And the juices that I have, it's not like apple juice, like store-bought apple juice. I'm actually making my own juices. I juice here at home, and Chase drinks some of those too. So that really helped us get it out of our system faster. I wanted to just kind of fill you in on that before we got really into the video. And then just one final thing. Again, this is Jamie Lynn and baby Chase, and often we're accompanied by a sweet little baby Kalina, who is 7 weeks old. Please, I would just be so grateful if you guys subscribed to my channel and liked this video. It helps me out so much. I hope that you guys are able to overcome this nasty virus as quickly as possible. But if you're into mom things and mom life and watching little Chase and Kalina grow up and seeing our daily struggles and fun times that we have, I would love it if you subscribe to my channel. It would mean so much to us. Thank you all so much, and have fun. Enjoy the video.